Good evening, everyone. On behalf of Mayo Clinic Health System and NAMI Chippewa Valley, I welcome you to our program tonight, Building a Community of Caring, Youth and Anxiety. Community health needs assessments across western Wisconsin have identified mental health as a top community priority. While we know there are genetic and environmental factors that increase our risk for mental illness, we also know that there are a number of protective factors that help promote our mental well-being. Tonight, we are here to learn about anxiety and youth. We will learn about risk factors, what signs and symptoms to look for, and what we can do to help, both through clinical care and through the resources and relationships that we have in our community. The goal of tonight's program is to grow awareness of important health and economic issues around mental health and provide tools for parents and families to raise healthy, happy, and resilient children. Dr. Pravesh Sharma will be the first presenter of the evening. Dr. Sharma is a child psychiatrist in behavioral health in Eau Claire. His medical training includes time in India, Texas, and the Johns Hopkins School of Medicine. He enjoys meeting patients where they are at and educating community about mental health disorders. He also has a special interest in adolescent addiction psychiatry and suicide prevention. Anita Valchek is the second presenter of the evening. Anita is a licensed professional counselor in behavioral health in Menominee. She grew up on a large family farm in rural Wisconsin. She has her master's degree in mental health counseling from the University of Wisconsin-Stout. Her special interests include anxiety disorders, child development, and foster and adoptive care. Following these presentations, we will be hosting a question and answer session. You're welcome to submit questions that you may have. You can use a paper that's tucked inside your folder, and a team will be walking down the aisle after both presentations to collect questions that you may have. At the conclusion of Anita's presentation, we will transition to the question and answer session. With almost 700 participants tonight, we anticipate we may not be able to get to every question, but we will do our best. Last, in your folder, you will see that there's an evaluation form. We ask you to complete your evaluation, and at the close of the evening's program, return that evaluation to the staff that are at the exits. We will be reviewing your feedback and we'll be using it to plan future offerings. And with that, and without further ado, I welcome to you Dr. Pravesh Sharma.
All right, this looks so big from here. Okay, so thank you all for joining us today on such an important topic. It's not just that this is an important topic because anxiety incidence is rising in the community, or as a matter of fact in whole US, but it's also very important that we spread awareness and learning and education about such an important topic, anxiety, so create a level of resiliency in our community. And as we're going to walk through this topic today, you'll see that how anxiety is related to so many other disorders. Depression, substance use, behavioral problems. So without waiting too much, why don't we start with it? The main objective for today's talk will be to learn about warning signs associated with anxiety disorder, learn about neurobiological basis behind anxiety disorder, and what are the evidence-based modalities that are available. So these are a few numbers to show that how significant anxiety disorder is in US. If you see 7.1% of children aged 3 to 17 years of age suffer from anxiety disorder. And if you just see in the teenage population, that number rises significantly to about 32%. And another important thing to notice here that anxiety disorder is associated with a lot of other psychiatric disorders, such as 1 in 3 suffer from depression, 1 in 3 suffer from behavior problems. More specifically with depression, if there are 4 children suffering from depression, out of those 3 will have some kind of anxiety disorder. So that's staggering. And out of these, only 59% of people are getting treatment. So imagine the plight of those 40% of people who are not getting treatment. They are going to be chronic sufferers. They are going to have other disorders. And the reason could be so many. Either they are not getting diagnosed, or sometimes I hear during my sessions that anxiety is considered to be an illness of weaks. So they don't want to call themselves as weak people. That's why they do not go and talk about this. Another important aspect is that sometimes it's very difficult to identify anxiety, especially in kids who are less than 10 years of age. Because kids, they have hard time telling you about their emotions. They have hard time telling you about their thought process. So probably what they're going to do is they're just going to tell you about their physical symptoms, like headaches, stomach aches, nausea, vomiting. So these are those individuals sometimes that they are not getting screened properly because we don't even know that they are suffering from inside. And this is the slide that shows that most of the disorders increase as the age increases, but more specifically, anxiety increased significantly from 3 to 5, from 6 to 11, and 12 to 17 years of age. So what is anxiety? We use this term a lot, but what exactly anxiety means? The core symptoms of anxiety are worry and fear. Just remember these 2 cartoons because we're going to come back on this slide again and again. Worry means that thing that you're anticipating in future. You don't know about this happening, but you still think about it. Fear means which is imminent. For example, a panic attack. You go to a grocery store and all of a sudden you see a lot of people there and you get a panic attack. That's a fear. Versus anxiety is the thought. So these are the main 2 features, core features of anxiety disorder. What is anxiety? Is it a normal thing to have? Or is it every anxiety is a problem? No. Actually, anxiety is important in a matter of motivation, survival, adaptation. Anxiety is something that you need in day-to-day life. For example, if you have an exam coming up in 1 month from now, and if you're not anxious about it, you're probably not going to study and you'll fail, right? Let's take another example. Say you go in a zoo and all of a sudden an animal start charging towards you. If you do not have anxiety, you'll probably die, right? At the same time, the right amount of anxiety and timely anxiety is also very important because you don't want that animal to come towards you, maybe just 1 centimeter away, and then you feel fearful. No, that is too late to have anxiety. At the same time, you have an appropriate response in regards to anxiety. You have to run, and run until you feel safe, right? Also, you don't have to run until you reach your house. That would be like too much of anxiety, right? So proportionate amount of anxiety is very important. And now how would you differentiate it with a problem? So any anxiety that is excessive, persistent, causes impairment, disproportionate, frequency, intensity, and duration is high. That is a pathological anxiety. And in anxiety, if that is affecting your functionality, that is a problem. As a matter of fact, in any other disorder that we talk about in psychiatric world, if that is not affecting your functionality, then that is not a problem. A patient who has anxiety disorder, if they're not going out with their family members, they're not spending time with their friends, their functionality has gone down in regards to academics, then definitely that is a problem. So always measure any symptoms in regards to your functionality in your day-to-day life. These are 4 specific forms of anxiety disorders. Before DSM-5, which is considered to be a Bible of psychiatry, post-traumatic stress disorder and obsessive-compulsive disorder used to be a part of anxiety disorder, but not anymore. So we have 4 specific forms of childhood anxiety. As the name suggests, separation anxiety, anxiety of separating from loved ones, generalized anxiety, social anxiety, and phobias. Why focus on childhood anxiety? Why are we talking about it? The reason for that is it is highly prevalent. As you remember from the first slide, 32% of adolescents suffer from some other kind of anxiety disorder. It is underdiagnosed and undertreated. 40% of children who are diagnosed with anxiety disorder do not get a treatment. It's a chronic course. If you have anxiety, it is probably going to stay whole your life if you do not get a treatment for that. It is highly comorbid, which means that it is associated with several other disorders like depression, substance use disorder, ADHD, and significantly impairment. Imagine about an individual who suffers from social anxiety and does not even get out from their house to go with their family members or go out and play with their friends. So this is highly impairing. It affects their social functioning, it affects their academics, and their life in general. So the next question arises, okay, I have anxiety. Then what are the signs and symptoms? What signs and symptoms should I look for in my kid or a teacher might say in my student that has anxiety disorder? So these are the 3 important symptoms associated with anxiety disorder. Whenever I say the word anxiety, always remember this triangle. Everything starts here. It starts with thought, any recurring thought or automatic thought that comes to your brain which does not make you feel good can lead to a physical symptom, and that physical symptom can lead to any kind of behavior, which could be an avoidance behavior, escaping behavior, pacing behavior, not wanting to do any kind of behavior, irritable behavior, aggressive behavior. So always remember these 3 angles, that thought leads to physical symptoms and that leads to behavioral symptoms. So what are these thoughts? You're probably going to hear a lot about automatic thoughts in a therapist's office or in a psychiatrist's office. What are automatic thoughts? Automatic thoughts are like popcorn thoughts. They come to your brain even when you don't need them. They still come in. Some automatic thoughts are good and some are bad. You don't need treatment of all automatic thoughts. You only need treatment for automatic thoughts that cause you a physical suffering or made you have any behavioral problems. Let's take an example. Say you're in office and at 3 o'clock, you look at your watch and you say, oh my God, I have to pick up my kid at 5 o'clock. Most of the time you'll be like, okay, I'll have 2 hours and I'll manage. The school is about 15 minutes away from here. I can still make it on time. But a person with anxiety disorder, he's not thinking that way. What he'll think, okay, It's 2 hours. What if there's a traffic signal? I probably get, there's a traffic on the road. I'm stuck in the road for about 2 hours. What if it started raining? My kid's gonna be outside for 15 minutes, and he's gonna be sick. Next day I have to call sick leave. My boss would be mad at me. I'll be, out of the job. We'll be homeless. What would happen to my kid? So he's just catastrophizing everything in his brain. That is pathological compared to the other person who planned everything. 15 minutes away school, I can still make it. So this is how these automatic thoughts can be good and can be bad. Automatic thoughts can also help you plan in advance, while at the same time, it can also cause you significant impairment. So this is one of the examples of an anxious thought where a child is overly focused on safety, danger, and physical harm. Another example could be what happens in social anxiety, that a kid worries about social humiliation, criticism, and embarrassment. This is a third kind of thought, automatic thought, where kid may be focused on perfection, not making mistakes, following rules. All these are automatic thoughts. And then comes the cognitive distortions. So cognitive distortions are simply the ways that our mind convinces of something that is not true, which means these distortions make you believe which is not there. That's why these are called as cognitive distortions. Let me give you an example. A patient with anxiety disorder, if they look at their parent, they have a flat face, they just look at their kid, not thinking about anything, but the kid with anxiety disorder might think, oh my God, my parent is not smiling at me. It means that they're mad at me? Have I done anything wrong? Are they going to punish me? So they they jump to conclusion very easily. For them, 2 and 2 is not 4. 2 and 2 is 5 for them. So these are some of the examples of cognitive distortions. Mind reading is very common. They just think what other people are thinking about them. Happens a lot in social anxiety. Fortune telling, blaming, personalization, everything that is happening in front of me is targeted towards me, which means that I'm taking everything so personal. Then comes to the physical symptoms. The physical symptoms are extremely common, especially in kids, because these are the symptoms that they are going to tell you. Rather than they tell you that I have anxiety, or I'm nervous, I'm having these bad thoughts, or I'm having cognitive distortions, they're not going to use these fancy words. They're probably going to tell you that, I'm having these physical symptoms: headaches, stomach aches, restless, muscle tension, all these kind of things that they are going to tell you. Now, physical symptoms can be immediate or they can be chronic. Sometimes I see patients in my clinic where they have long-standing gastrointestinal problem. They have long-standing headaches. And they had all the workups done. They had all the imaging done. They've been to primary care doctor, gastroenterologist. They had done all the scopes, but nothing was found. We start a trial of antidepressant medication for anxiety, treatment goes away. The symptoms goes away. So this shows that these symptoms can stay with you forever, and they're so chronic in nature. So whenever I see a patient with these long-standing physical symptoms, anxiety is usually the first thing that comes to my mind. These are some physical symptoms: restlessness, fatigue, shaking, sweating, rapid heart rate, dizziness, lightheaded, stomach ache. So if you see, anxiety affects each and every system of your body, from head to toe. Everything. And actually, if you look at these symptoms, this reminds us that we were animal once. Imagine your dog or imagine your pet. If your dog or pet is afraid, what's going to do? It's going to run away, right? Or it's going to hide somewhere. The same thing happens with us, because we were animals once, right? So what happens in anxiety is that you need more amount of blood in your limbs, because that's the place you need more blood so that you can run, so that you can fight, right? So you need more blood in your arms, you need more blood in your legs. So all the blood goes down there, so which creates a deficiency where? In your brain and in your gut. Everything is going to your legs, everything is going to your arm, creates deficiency of blood in your gut and in your brain, and hence these symptoms. If you have less blood in your brain, you start to have headaches, you start to have dizziness. If you have less blood in your gut, you start to have nausea, you start to feel vomiting, diarrhea. So all these things are happening for a reason, right? So that you can run and you can fight. Another important thing is that when we have these symptoms, since less amount of blood is going to your brain start to mess up with that. You start to have cognitive distortions because less amount of blood is going to your brain. So how can you bring more blood to your brain? You cannot turn upside down, right? So that your blood goes to your brain. What you have to do is you have to take deep breaths. So more oxygen comes in, more amount of blood that goes to brain has more oxygen. Progressive muscle relaxation is another thing that I talk about during my sessions, so that you squeeze each and every muscle of your body so that blood goes to your brain. So these are the two important things that usually help kids who have physical symptoms in anxiety. This is a third triangle, if you remember. The first one was thought, the second one was physical symptoms, and the third one is anxious behaviors. These are some symptoms of some anxious behaviors: freezing, fidgeting, pacing, yelling, aggression, and asking same question again and again just to seek reassurance. Avoidance is very important symptom that you see in anxiety. It is a form of externalizing symptom. What does that mean? Externalizing symptom means anything that you're seeing from external is the externalizing symptom. Physical symptom is externalizing symptom because you're seeing from outside. Avoidance behavior is an externalizing symptom because you're seeing from outside. This is the most common symptom that parents come to me and talk about their kids. My kid is not going to school. He is just hiding in his room. He's not wanting to come out. He's not coming and socializing with his friends, because these are the symptoms you're seeing first. Physical symptoms are the symptoms that a kid tells you, but these are the symptoms that you witness. Teachers usually tell me a lot about avoidance behaviors. So let's put that in the perspective of school anxiety with the same model of anxiety. So see about the anxious thoughts. The anxious thought was that I don't know how to solve a math problem, or I hope the teacher doesn't call on me. So this was a thought, okay? So kid keeps thinking about it. He could not tell to the parent. He couldn't tell to the teachers. That lead to a physical symptom: heart racing, stomach ache, hand shaky, and sweating. These symptoms are not good. Nobody wants to experience these symptoms. Imagine an anxiety symptom happening to you every day, all the time, 365 days a year. That would not be a pleasant feeling to have. So what would happen? The kid would avoid. He would avoid going to school so that he can feel better. And this cycle continues: thought, physical symptom, and behavior. Now, sometimes people ask, like, what is the cause? Why my kid? Why is that my kids suffer from anxiety, but other kids do not? Well, the problem is that no two people are same. No two people's experiences are same. And as a matter of fact, no two people's experience of anxiety is same. So hence, one answer probably not going to fit everybody. But, scientists are trying to find any risk factor that are associated with anxiety disorder. Because if you can intervene before the anxiety symptom develops, then maybe you're able to help your kid. So these are some of the reasons behind the anxiety disorder. One is genes. What kind of genes you were born with? That is a big one. Second one is what kind of temperament you were born with, what kind of temperament you had. Third thing is, what was your learning over the course of your life? When you had a stressful experience for the very, very first time, how did you react? How did the people around you react? Third one is modeling behavior. Kids are just clean slate. They usually learn behaviors from people around them. It could be teachers, it could be parents, it could be your peers. So everything that they exhibit could be a modeling behavior. So that's why I say to parents that if you have anxiety disorder, and if you're not getting a treatment, it's very, very important that you seek treatment as well. It's just like, if your glasses are blurred, you're probably not going to see a clear picture unless your glasses are clean. The same thing is with parents suffering from anxiety disorder. If parents are suffering from anxiety disorder, or as a matter of fact, a sibling is suffering from anxiety disorder, they all have to take a treatment. Psychiatric disorder usually run in families, especially anxiety and depression. They have a very high penetrance from one generation to another. So if your child has anxiety, there are significant chances that either you suffer from anxiety, or one of the siblings suffer from anxiety, or grandparents suffer from anxiety. Somebody is there who had suffered from anxiety in their life. If that is the case, it's very important that you all get a treatment. The second part is about learning. That is also very important, like how you learn throughout your life is also important. Let's take an example. Say a little Johnny, 4-year-old, 3-year-old, never afraid of a dog, okay? He was only afraid of loud noise. So loud noise led to fear, okay? That is the only thing that he was afraid of. Never afraid of a dog. Now what happened one day, he was in a park, and he pulled the tail a little too strong, okay? And the dog barked. When the dog barked, little Johnny just heard the loud bark, and that gave a fear to him, okay? And if this continues to happen 3 or 4 times, what would happen? He would associate loud noise with dog. And from here onwards, he will start thinking, okay, loud noise, dog. Dog produces loud noise, which means I have to be afraid of dog. This is how you learn throughout your life. It starts very early. All these learning behaviors starts when you are 2 years of old, 3 years of age, 4 years of age. And this is how you start to have a fear. Because when you were born, you were not afraid of anything. You'll see that you take your 2-year-old kid or 1-year-old kid on the top of a building, he's not going to be afraid unless he knows that he associates that thing with something else. So that is one part of a learning called classical learning, which means pairing. One stimuli which never produce any fear is paired with another stimulus that produces fear. So now, if you see, loud noise produces fear, dog and loud noise produces fear, which means now dog alone can produce a fear in little Johnny. So this is how you learn over the course of your life. Another important learning aspect is award. So we know that behavior are influenced not only what happens before them, but also what happens after that. So if you provide a reward after a behavior, it will going to get reinforced. Now, that behavior could be a problem behavior, or that behavior could be a good behavior. So if your kid does something good, and if you give a reward to that, that behavior will continue. The same thing happens with anxiety behavior. For example, avoidance. If you give a reward after that, then that behavior will continue to happen. And that's what the operant conditioning is. These are the 2 main important learning behaviors: paired association and operant conditioning. Now, another important point here to discuss is about like how these anxiety behaviors are maintained. What is the reason? I know, okay, association causes anxiety, operant condition can cause anxiety, but what is causing them to continue to have anxiety disorder? One thing that to consider is that these thoughts and feelings are highly uncomfortable for an individual. So once you avoid an anxious situation, that's a reward for you. For example, if you're sitting here, right, and for some reason, this environment is so anxious for you, and once you leave from here, this will be rewarding for you. Why? Because your anxiety gets better. That's how we all work. If you go to a place where there are 5 or 6 people, you don't know any of them, and what will you do? You'll take a glass of a beer and you'll just corner yourself. You feel better. Why? Because your anxiety is better. In general, this is what human beings are. They do not want to fear. They do not want anxiety because this is an unpleasant feeling. Now, let's go back to little Johnny's example. Now, how would little Johnny experience about anxiety? He will continue to avoid seeing a dog, which means if he does not see a dog, he will not have anxiety forever. Of course he will not, because he has associated dog with a loud noise. If he's not going to hear a loud noise, he's not going to be afraid. He will not have anxiety. So he will continue to avoid seeing the dog. This is how the avoidance behavior continues. And put that in a perspective with school avoidance. If your kid is afraid of going to school, he will not go to school because that would decrease his anxiety. And anxiety is something that nobody wants to experience. So this is how these behaviors continue to maintain throughout the life. Unless you intervene at a stage of avoidance and escaping behavior. But if you provide a reward after each and every avoidance behavior, like for example, if a kid wakes up in the morning and he says, my stomach hurts and I don't want to go to school. And if a parent say, okay, that's fine, don't go to school. So this is how these behavior will continue to happen. And the kid will continue to have avoidance behavior. We talk about parental accommodations, about providing accommodation. So any accommodation that would reinforce a negative pattern. When I say negative pattern, which means avoidance and escaping behavior, because these are 2 very important behaviors that happen in anxiety. If a parent provides accommodations to these, then these behaviors will continue to happen. Providing excessive reassurance, that's the same thing. About providing excessive reassurance means, and Anita is going to talk about resiliency in next section, and rescuing negative emotions. If you rescue negative emotions a lot about your kid, they will not develop resiliency and they will not develop a coping skill to manage these problems on their own. Overly criticizing your kid, this will lead them like, am I doing everything wrong? My kids say, don't do that, don't do this. It means that whatever I do is wrong. So before making any decision or before making any decision about their life, they will be worried. And this is how this anxiety will continue to happen all their life. Neurobiology. Everything that is happening with anxiety has something to do with the brain. We are still in a process of learning about this. What areas of the brain are important that are causing significant anxiety? 2 main centers of anxiety are amygdala and corticostrial thalamocortical circuit. Good luck with that. So these are the 2 brain centers that cause anxiety. Amygdala is responsible for your fear response. Amygdala is associated with several other centers in the brain that leads to increase in heart rate, that leads to increase in respiratory rate, that leads to increase in cortisol, increase in epinephrine. So whenever amygdala receives an input from your eyes or from your cortex, it goes to amygdala, and amygdala reaches to other centers of the brain to produce anxiety response. Okay? So amygdala receives signal from your eyes and from your brain, and then it connects to other center of the brain to produce anxiety symptoms such as increase in heart rate, increase in breathing, and increase in cortisol. Now, if you remember the second or third slide about chronic symptoms of anxiety. Now, if these symptoms or amygdala hyperactivity continues to happen whole your life, which means your cortisol will continue to rise throughout your life. Your epinephrine level of the body will continue to rise throughout your life, which we don't want. Why? Because if you have these neurochemicals rise in your body whole your life, you start to have more symptoms of cardiovascular disease. That puts you at a risk of diabetes, that puts you at a risk of future heart attacks, stroke, and it can also lead to asthma exacerbation. So anxiety symptoms, if they continue to perpetuate, these symptoms can also happen. This is another very important slide. Here, this is your, I think this is not working. Faint red dot. So this is your brain, which is cortex. And this is hippocampus, amygdala. Sometimes have you seen or have you heard that memories can also trigger fear response, especially in people who have PTSD. So your hippocampus is connected to amygdala, and amygdala produces fear response. Where are your memories are stored? Memories are stored in hippocampus. That's why when you have any traumatic memory or anything memory that is not good, that can trigger to a fear response by this pathway, okay? Now what happens is that whenever you are in any kind of, say, an accident, or if you are in any kind of traumatic incidents, amygdala and hippocampus stores that memory so that in future, if you have similar circumstances, that can produce a fearful response because your brain and body does not want you to deal with a similar problem in future. That's why hippocampus and amygdala stores this memory for future. Let me give you an example. About a month ago, I was in my car with my family, and we were just stopped at a traffic signal, and somebody rear-ended our car. And thankfully, everybody was safe. But from there on, for approximately 3 weeks, I was so scared that whenever I would stop at a signal, I would look in my rear mirror. I will look that I hope somebody is not, driving too fast behind me. I was like very anxious. So possibly what might have happened is, and it was not just happen at the place where accident happened, it was happening at everywhere, at every stop sign, at every traffic signal. So probably what happened was that hippocampus and amygdala stored that memory for me, and they also stored the context, and context was stop sign. Context was anybody who was driving fast behind me. So they stored it in it so that next time when I'm at a traffic signal, I'll be more careful, right? But do you think that's a good fear response? I don't think so, because every time when I would stop at a stop sign, I would have to look back, or I have to see like who's driving behind me, which is not a good feeling. So what happened? Then I utilized my cortex, which is the top part that you see. This is your cortex. And this part of the brain is plastic, which means that you can train that part of the brain. That's what you do in therapy. When you see and talk to a therapist, this is the pathway that they are changing. Because when you learn something, new pathways are formed. They form from your cortex, from cortex to hippocampus to amygdala, bypassing the fear pathway. So what happened is that I started thinking, I started saying to myself that, okay, if I kept looking, this will put me at a more risk of future accidents. And how can I control anybody else? I cannot control how people are driving here in this city. And I kept remembering this again and again. So eventually what happens, that fear subsided. So basically what might have happened is that new synapses might have formed or new pathways might have formed from my cortex to hippocampus to amygdala so that this fear response does not happen, right? And this is exactly what we do in therapy. And that's why therapy is so important. Because when you go in therapy, you learn new behaviors and you learn new coping skills so that new tracks are formed bypassing hippocampus and amygdala. And that's why it's so important that we continue to talk to our therapists so that new pathways can be formed. And these pathways, unfortunately, not going to happen with just one therapy sessions. Because what is happening is it's happening at a molecular level. It's happening at a level of neuron. For this much track in your brain, you need millions and thousands of neurons. And to build that track, you probably have to be in therapy for about 6 to 7 months. That's why when you go to your therapist, they'll say you that compliance is very important because once you continue to learn, you just cannot have a break in it. Because the problem is, the newly formed pathways are not very strong. They dissolve over time. While hippocampus, amygdala, fear response, they are strong pathways. You were born with these pathways. We are making the artificial pathways to bypass the original pathway. So these are not very strong. That's why we continue to use our coping skills for anxiety. Next part will be the treatment strategies for anxiety disorder. So the main treatment strategies are two: therapy and medications. Medications target these pathways that I just told you. We found that these pathways involve several neurochemicals such as serotonin, dopamine, acetylcholine, norepinephrine. We give external chemicals or external molecules who go inside this brain cell and change your DNA to produce a new protein. That's the reason why when we give you an external medication, they take time to work, because they are not external serotonin that you take, goes to your blood, and directly goes here. No. What is happening is that they're going inside the cell and changing your DNA and making new protein and new neurotransmitters. That's why these medications take time. Versus, if you see this pathway, this is quick compared to taking medication. That's why sometimes when you go to see a doctor, say a psychiatrist, or if you go to see a therapist, you feel an immediate relief in your anxiety because of the coping mechanisms. So behavioral therapy, two are the most important behavioral therapies available. One is exposure, which is a gold standard therapy for anxiety disorder. The another one is flooding. Flooding is usually very limitedly used in therapies these days, which means, in a crude way, if you're afraid of snakes, we'll put you in a chamber with snakes. Probably we're not going to do that. So that's why it is not very fancy therapy to work with. The other one is systemic desensitization, which is on a basis of a principle, which means that you get habituated with your fears eventually. For example, if you give a talk or if you have a performance, you're probably going to be slightly anxious in first 2 or 3 minutes, but after that, you get better. This is what habituation means. Exactly, we use the same principle when we do exposure. We slowly expose you to any kind of fear or anxiety that you might have. Say, for example, if you have a social anxiety, then we slowly produce an environment around you that will create a small bits of anxiety in you, and we continue to increase that stressful environment. This is how exposure works. Flooding, we usually don't do. Response prevention therapy means, as the name tells you, response prevention, which means that doing some kind of coping skills to prevent escape behaviors and to prevent avoidance. This is what response prevention therapy is. Well, this is my flooding. So I was telling somebody over backstage that my wife is from the mountains in India, and when we married at her house, and this was the path that I had to take to go to her house, right? I was so scary. I was like, I cannot do that, but I had no choice, right? So here's my flooding. I just sat in the car and just went there. I'm not sure I can do that again, but who knows? So this is the Cbt Triangle, the triangle that I showed you in a first or second slide. That is the basis of Cbt. When you go to see a therapist, and Anita is going to talk to you about that, they work on this model. They work on thought. Because unless we know what thought is causing anxiety, we won't be able to intervene. So sometimes, therapy, when you go into therapy, it takes several weeks or even months to even identify what kind of thought is producing anxiety to you. I remember when I was in residency and we used to do CBT, there was a patient that I could not identify thoughts for about 5 months. And after 5 months, then he was able to tell me about his thoughts that are triggering behaviors and physical symptoms. So sometimes it takes a lot of time in therapy sessions to understand that what are these thoughts that are causing these behaviors and anxiety. So again, the intervention in anxiety, the most evidence-based medication for treatment in anxiety disorder is SSRI, such as Zoloft, Prozac, and Lexapro. And CBT is another modality of treatment that we utilize in anxiety disorder. And the studies have shown that the combination of these two have the maximum result. So only CBT or only medication does not have that much remission in treatment, while the combination has about 60 to 80% response rate. So how parents and school personnel can help? Anita is going to talk more about this, but these are the snapshots, like understanding the signs and symptoms of anxiety, understanding what are the thoughts, what are the behaviors, and physical symptoms. And most important is tying them together. That's very important, right? I mean, only physical symptoms have no meaning unless they are associated with what kind of thoughts you have. Only thoughts do not have any meaning unless you understand what are the behaviors that these thoughts are causing. So understanding this whole paradigm is very important. Collaborators among teachers. I sometimes call teachers during my sessions so that we can have a group sit down and we talk about what are the problems that kid is facing in school. Parents are a role model to their kids. So if you suffer from anxiety, it's very important that you also get a treatment. And let the kids face their fears. It goes back to the same principle of habituation. If they continue to face their fear, eventually their brain will understand that this is not a threatful situation for me anymore. The reason why these anxiety symptoms happen is because their brain think that this current situation is threatful for me, and that is not. So let them face their fear. And in summary, this is the last slide that I have. Anxiety disorders are common. If they are untreated, they have severe consequences. Early identification is the key. Then treatment definitely works. Parental attention is important. Always a positive reinforcement. Ignore the behaviors you want to see less of. Thank you. This was my presentation. Thank you.
Hello. How is everybody? You all are the testament to the need in this community. I'm going to start with that. So I'm glad you all came. And I think he left some big shoes to fill, okay? So as you heard earlier, I'm a therapist. I actually work in the Eau Claire campus, now transitioned last year from Menominee. And my specialty really is with kids. I see kids with anxiety all the time, and it is increasing all the time. Okay? Here are the objectives that I'm hoping to get to. So, learning CBT, which in my world is cognitive behavior therapy, understanding effective accommodation versus compensation. And while watching Dr. Sharma, I learned that I use the word accommodation differently than he does. So you're going to have to bear with that discrepancy. And then learn ways to support resiliency in youth. I clicked too many times, I think. Okay. Cognitive behavior therapy, which is also called CBT, focuses on how thoughts, feelings, and behaviors work together. As you heard earlier, sometimes it's really tricky to understand the thoughts that drive the behaviors and drive the feelings. What we see in our community, in our classrooms, in our homes, is the behaviors. Sometimes we see the feelings, the crying, the sadness, the overwhelming frustration, but more often than not, and especially in little kids, it's behavior. Tantrums, not able to comply with rules, things that look like opposition. In the 1960s, Aaron Beck set out to prove something. He was going to find a way to indicate something that he wanted to stand behind. And in doing so, he recognized that he was wrong, which is how cognitive behavior therapy was born. So he recognized that in all people there's an irrational belief system when they experience anxiety that continues to drive the feelings and the behaviors. Cognitive behavior focuses on the present. It's to teach the stressors, responses, and the ways to change the response, and it's inherently optimistic, which is why I love it. Anybody that knows me, I see the good in almost everything. So here's that cognitive triangle: thoughts, feelings, behaviors. So thoughts that you and I have, as Dr. Sharma was talking about, really illustrate how we problem solve, how we make decisions, how we adapt. When you get the anxious individual, you get the distortions, the irrational beliefs, those upholding patterns that keep the behaviors and the feelings going. So, when we see the brain and the mechanics of the brain working together, we then have that conditioned response. I can also react to the emotion that other people have in a way that triggers that anxious feeling, that anxious behavior, and brings out those thoughts. Sometimes when I ask kids in the clinic, what's the thought that's driving this? They tell me something. More often than not, that's not the real thought. I don't like it. It doesn't feel good. That's true. That's what's happening. But that's not the thought that's necessarily driving it. I made myself some notes so I didn't forget anything. Anxiety in the brain, I call the brain bully. So everybody knows what a bully is, right? Somebody that repeatedly, intentionally is causing some harm and distress to you. Well, that's anxiety in our brain. So it is repeatedly showing up, repeatedly reminding you of those same thought patterns, and it does not feel good. The cognitive distortions, and we saw a screen that listed some of those: blaming, emotional reasoning, fallacy of change, fallacy of fairness, catastrophizing. Those become part of that irrational belief system. Cognitive distortions, we are challenged to think about what is the fact and what is an opinion. So when we start practicing CBT, that cognitive behavior model, I tell the kids they're like a detective. We have to figure out where the thoughts came from. We have to figure out what those thoughts are, what the replacements are going to be, how are we going to shift all of those thoughts. So the list up here is really designed for us to think about what's a fact versus what's an opinion. So anybody can yell it out, but the first one, I'm a bad person. Sam told me that she did not like what I said about her. Nothing ever goes right. This will be a disaster. I'm not attractive as they are. I failed the test. I'm overweight. How could I resist, right? You see within these how quickly then they bring about the feelings and the behaviors that we then engage in. So if I'm looking at an example from up here and I say I'm a bad person, what's the likelihood I think people want to spend time with me? I really don't. Which also then makes me believe I'll never be invited to the birthday party as a kid. Nobody's going to want to sit by me at lunch. It doesn't matter what I say. And so it perpetuates itself. So within the cognitive behavior therapy model, we learn to do something called cognitive restructuring. So, figuring out what the thoughts are the hardest part of cognitive behavior therapy. You can outwardly say what you believe the thought is, how it sounds, what is coming to your mind. But typically there's an underlying thought, something that we are just not able to pinpoint. So an example that comes to mind is this young man was talking about how if his mom was late, he could not function. So I said, was mom ever late? One time, I think. How late was she? I don't know. Felt like forever. Mom wants to talk desperately. She wants to tell me 2 minutes late. She was 2 minutes late. But mom is going to be late. Is that the thought driving it? No. It took us a long time to figure out that the thought that driving it was, I don't really have any other friends besides my mom. And so without my mom, I'm in big trouble. So I need her to be here, because otherwise I'm going to cry, and I'm going to be awkward, and nobody's going to like me, and people aren't going to help me. And so all of that distorted the way that he could problem solve in that moment. So we had to start tackling the restructuring and those thoughts about you don't have any friends. Nobody else is going to want to be around you. Becoming aware of the thoughts and the feelings. That's part of that process that we had to do. I didn't learn that in one 50-minute session. It took me a long time to get there. And when we got there, I think there was this huge victory of, oh my gosh, now we know what we're doing. So I'm not a good person. Behaviorally, I avoid people and situations. The feeling is I'm sad and I'm lonely. So that little guy was sad and lonely, felt rejected, and spent most of his time in his room. If he was with his mom, people said, nicest kid ever. Which is part of the reason we had a hard time figuring out what the actual think area was. So if I reframe this into I am a good person, I'm going to interact with people and situations, and I'm going to be less sad and lonely. Now that sounds pretty easy. I just tell myself I'm a good person, right? Everything's fine. I hear some giggles. It's not that easy. And if anybody's dealt with a kid that has anxiety, try to convince them of that. So from a therapist standpoint, it's never my job to do the work. It's my job to help that person that's struggling with anxiety to know how to shift the thinking, to recognize the thinking errors, to break it down and understand. So sometimes I start out by giving this little lecture about what's happening in the brain. So we learned about what's happening in the brain. And I'll say, so let's think about if I need to be a good decision maker and a good problem solver, what part of the brain do I need to use? Well, the prefrontal cortex. So that's this part. That's the farthest away from the amygdala. Seems likely those two wouldn't work together. Some individuals love that. I know exactly then why it's doing what it's doing. It's still needing to understand the thoughts that drive the feelings and the behaviors. From a parental standpoint, if I have a whole bunch of behaviors like I have a headache, a stomach ache, I'm feeling nauseous, I'm going to let you stay home from school. The feelings are relief in that moment. I don't have to deal with this really terrible thing. What's the thought that started all this? It's almost never, I don't want to go to school. That's where it grows to, because that's the easiest way to eliminate the negative feelings. So you can start to see how they're interrelated. But I have to then figure out and go from there to say, what is the thoughts? What brought about the initial stomach ache, headache, and vomiting? Now, if I could just get rid of the headache, the stomach ache, and the vomiting, could a child still function at school? Potentially. Teachers start to talk about how some of those kids function at school. Hood up, strings pulled. Head down, not talking. In the bathroom, skipping classes. Disruptive, being loud. So again, there takes some work in figuring out what are the thoughts that are driving this. Is there a skill deficit? Is it I'm not going to be good at math? Is it that I have no friends at school? People are looking at me. So again, you start to be the detective and look at where do the thoughts go. I'm sure many people have seen the anxiety iceberg. So on the top becomes the behaviors, and on the bottom is the feelings. So again, most of the time what we see is what's on the top. And little people are not super aware of themselves. So sometimes the analogy I give people is the potty training analogy. How do we know that a kid is ready to be potty trained? Sometimes I'll hear parents say, well, they know how to use the toilet, they're just not wanting to. They go when we sit in there, I set the timer. Well, we've taught them stimulus control. So again, if you look at learned behavior and how the brain works, but the awareness of them going, oh yeah, this is what my body is telling me. I have to go to the bathroom, so I need to go right now. Sometimes when potty training fails, that's what's missing. So if I want to teach somebody to handle anxiety and handle it well using cognitive behavior therapy, they need to have the awareness. They need to understand that, oh yeah, this is what my body is telling me. And here's what I do when that happens. So with my toilet training example, I teasingly say, if I rose my hand and said, oh, excuse me, I have to go to the bathroom, you would all let me go and it'd be fine. We know where I'm going, right? Nobody would tell me I can't go. So what happens if I raise my hand at school and say, oh my goodness, I'm really anxious. Now what? Where do I go? What do I do? So cognitive behavior therapy is nice because it teaches the skills they can do in their seat. Do it anywhere, anytime, any place. We also have to recognize what emotions are normal and acceptable. So if I'm sad or worried about grandma because she's sick, that's a good place to be. But if I'm sad because my friend didn't come to my birthday party, what am I going to do? We need to validate some of that emotion, but we also need to teach the coping skills and the shifting to go with how do we move forward. We want to avoid making predictions about behaviors. I see this a lot. We're talking about something in the office. The kid starts to get teary, and the parent interjects and says, oh, they're just something, something, something. Well, I don't know if that's true yet, because they can talk and they can tell me that's a prediction about behavior. Oh, I'm too fast of a clicker, sorry. So another example here. I don't like being in crowds, and other people don't have this problem. So feelings, nervous, panic, embarrassment, fear, behavior is to avoid. So in exposure, we can put people in situations where they can try that out in a small group of people, in a limited amount of time. You're going to be uncomfortable. I tell this to people all the time. It's not going to feel good and it's okay. So what are we going to do when you don't feel okay so you can withstand that for that little bit of time? From a cognitive behavior standpoint, I have to start investigating about what in the crowd drives that. Am I going to have to talk to people? Is there an expectation I've set for myself? What if somebody asks me a question I don't know the answer to? So when I go to the party with grandma and grandpa, here's what I can do. Other examples include, I always screw things up. I'm such a loser. Versus, everyone makes mistakes, including me. What's wrong with me? Versus, all I can do now is try my best to fix the situation and learn from this experience. She's ruining my family. I want my family to be the same. I really don't like having people in my space. I feel way too anxious. I can't do it. It's okay and normal to feel anxious. It's not dangerous. So this is titled Parenting Tips for Anxious Children, but it's applicable to teachers. It's applicable to community members, friends, interacting with other people. Expectations of your child. Match the expectations for your anxious child to those of another child. We go to birthday parties, we order our own food, we make decisions, we talk to adults. So I might slow down the pace, I might allow for the process in achieving the same outcomes. I might break down the task, role play, and talk it through. If avoidance is part of the reason that anxiety is reinforced, I don't want to be part of the problem. So everybody needs expectations, including us. There's a lot of studies that talk about kids that function the best have some mild to moderate stress in their life. They learn the skills to cope with the uncomfortableness. When we have expectations for kids too, we want to be clear about what those are. How are you going to get that piece of candy from mom? Oh, be good. What do you mean be good? What does that look like? And almost never do I get a good answer for that. If you're expecting your 4-year-old to sit in church for an hour, never talk, do exactly what all the adults do, I'm in the wrong profession. So if the expectation is that you whisper, you read the books and do the coloring pages I brought for you, and we stay in this pew, and you're going to get a piece of candy, that sounds like a pretty good expectation. Now keep in mind, I want expectations to be realistic to age and development. So just because I have a 17-year-old doesn't mean that they're going to be good at saving money if they have a job. So again, what's the expectations? How do I define it? Build personal strength. Offer opportunities to face challenges and praise the effort toward facing them. Let's just start with that piece. Brave behavior. Let's give kids the opportunity. I love that word, opportunity. If I never provide the opportunity for a child to fail or to show me that they can do something, they're probably never going to do it. But if I give the opportunity, they might just surprise me. Now, they might not do the laundry the way I want them to do it. But what a great opportunity to challenge them. Have children do tasks around the house to contribute to the family. Why is that important? So personal strength. If I never feel connected to another person in my life, this is what I see happening in anxiety. I don't see anything past this. So it's really easy for me to avoid. It's really easy for me to stay in my mindset. Sports, music, drawing, other great places for them to show you their skills. Let learning happen within your child's will. So the message given when taking over is the inability to believe your child can do it. Well, if we're talking about cognitive distortions, if I repeatedly take over and never ever let them talk or do something, well, gosh, I stink. I'm not good at anything. What's the evidence to support it? Every time I start making supper, my mom takes over. Do not reassure that everything will be okay. So when the school shootings started to happen and kids would come in the clinic and the fear was, oh my gosh, there's going to be a shooting at the school. I don't know what to do. I'm so afraid. Sometimes parents would say, oh, that's not going to happen. And then the eyes would get really big when I said, well, we don't know. I'm not a fortune teller, so I have no idea. So what are we doing? Well, the teachers are like making us do these drills. So that can bring out fear and worry. And I said, so why are they doing that? So I know what to do. So again, don't reassure that everything will be okay. Some things are not going to be okay. Some things are not going to work out perfectly. You didn't get invited to the birthday party? Okay, you didn't get invited. That stinks. Yes, I'd like you to be invited. Don't make a party for themselves because they didn't get invited. So again, we need to be good advocates to help meet them where they're at, to understand that some of that emotion is normal. This is part of how life works. So when I said fallacy of fairness too, in families where there's lots of kids, sometimes the kids all think it should be fair. So-and-so has a phone, I should get a phone. Who's heard that? No, you should not. Why does so-and-so have a phone? So we start there sometimes. Again, it's really this dialogue that helps me understand where's the cognitive distortion. What's the stinking thinking that's keeping this going? Model how you think through and respond to questions your child asks. Well, why did you think I decide that? Is sometimes the favorite thing I like to say. What will I do different next time? That did not work out so good. Help children handle feelings. So it's okay to let children experience some anxiety. It's not dangerous, something to learn to cope with. Set boundaries that allow you to take time for yourself despite the anxious child wanting to be with you all the time. Teach ways for them to express the emotion. I'm tired of them screaming and crying and whining all the time. I believe you. I would be tired of it too. But if I can teach them to recognize and understand that this is what's happening, they're going to be much better at telling me. So it's not the same as making predictions about behaviors. It's trying to give them the pieces and the tools they don't have. So I look at that as a skill deficit. If I do not yet know how, or I'm not very good at it, I need to practice that. So label emotion. Something really fun that happens in my office, I'll say, how do you know Dad was mad? Dad's usually a yeller. How do you know Mom is mad? Mom sometimes is a yeller. Sometimes she's moving really quickly and cleaning a lot. Sometimes she's in her room. So that ties into the second part a little bit. So if I'm really mad and I'm going in my room, you know what? I need a break. Right now, I'm mad, and I'm going to take a break so that I can actually talk to you about how we're going to make this better. Or I can figure out what we're doing next. But right now, this is not good decision-making place. So anxiety sometimes comes out as aggression too. And interestingly enough, that's when kids recognize something's wrong. So what did you do before that? I don't know. And then I say, so you've been shaking your leg in here, twirling your hair, and chewing on the string on your sweatshirt. Does any of that happen the rest of the time? Oh, yeah. So again, I have to start to recognize it and model it. So then we start to give them the pieces so they can label and express the emotion. Oh, this is my body saying, I'm nervous. This is my body saying, I'm afraid. So take time for yourself. What a great thing to model for your kids. I love spending time with my kids. I've got 4 of them at home. They're lovely. But I say to them sometimes, you need to find something to do because I need 15 minutes, 20 minutes to myself. When they were really little, I'd set the timer. That was a great 15 minutes. And the timer goes off, and guess what happens? Here they come. They're ready. They're ready before me. But again, it's a really nice way to say, hey, we need space to process, to think, to not always be governed by the things in our environment. Something else that happens if we express emotions without really communicating it well, or we express it in ways that are not positive, is kids then get afraid to tell Mom and Dad when something's not okay. I think you're going to be mad at me. I might. I don't know what's happening. Should we try it out? Well, how will we know if I get mad at you? I don't know. So again, here's where we start to break it down. What do I do when I get mad? Oh, you get really quiet. Is that so bad? No. I don't like it though when you're mad. How long does it last? Right? So again, you start to look at how do we do these cognitive shifts. This might be one of my favorites. Passing on your fears. Dr. Sharma was talking about how kids are a clean slate and they don't have any fears. And I think people can recognize that in really little kids. Yes, they are pretty fearless, but there is nothing that I struggle more with than the kiddo who is afraid of spiders because Mom is jumping from chair to chair to chair, screaming, "Oh my gosh, kill it! Hurry up!" Well, how do you know you're afraid of spiders? She is. Yes, that's very obvious. She is. When's the last time you've seen a spider? I haven't. So if you're afraid, how much do you think you protect your child from your fears? Much more than you're probably willing to identify. If I'm afraid my kid's going to make the same mistakes I did as a youth, okay. And sometimes parents overcompensate the other way where they say, "I turned out fine." Neither of those are the best. So somewhere in the middle, again, meeting each situation for what it is. Sometimes we just have to explore the world to even see what happens. So if I sit back and I watch the kids interacting with the world, take them to new places, give them time, what happens? If we're at the park, do they start to interact with other kids? Or do they sit on the bench by you? So again, another really great way just to model what you want kids to do. If I get up and play with people, my kids are probably more likely to get up and play with people. Working together as parents. So if one parent is the good guy and the other is the bad guy, and I'm always trying to guess where I fall or what to do and when to do it, I'm now reacting to the environment around me. And it becomes really, really confusing about what's right and what's wrong. So as parents, sometimes modeling that dialogue in that moment becomes really important. Consequences. Set expectations and have limits and consequences for inappropriate behavior. So producing competent, self-confident, happy children results from reasonable expectations, clear and consistent limits and consequences in conjunction with love and acceptance. Consequence and punishment are not the same. Sometimes the consequence is feeling a little uncomfortable to try something new. Sometimes the consequence is coming up with 3 other ways that you might think about a situation. So I've said before that our kids really don't get in trouble in our house. What I mean is they don't get punished in our house. Every experience where there needs to be a consequence is an opportunity for learning, is an opportunity to work through some discomfort, some stress, something that did not go the way we thought it would go. Also, anxiety and inappropriate behavior are not the same. So if somebody says that's their anxiety, it still doesn't make it okay for them to do inappropriate behavior. So if your anxiety has you slapping mom or dad in the store, it still does not make that behavior okay. I talked about this a little bit. So the influence of others' response to behaviors or feelings. So here's where I said, Dr. Sharma and I have a difference in the use of the word accommodation. So I'm a true believer in accommodation. I am not a believer in compensation. For me, compensation is the process of concealing or offsetting a psychological difficulty by developing in another direction. So in compensating, I enable avoidance, the very thing that keeps anxiety going. But in accommodation, I am figuring out ways to adapt or adjust to the stressor, the someone, the something. So let's say, for example, that I am not good at putting my thoughts onto paper. And so the idea of compensating would be you never have to write them on the paper. You can just tell me. Accommodating might be that we type them. You write a sentence, I write a sentence. We use fun pens. We still do the task. We don't take away that demand. The skill deficits that are missed are incredible. One of the primary that I see is a kid's ability to take the word no for an answer. Guess what? We are very notorious for compensating. I cannot handle them screaming and crying anymore, so I gave in. I don't like going to school. I don't go to school. I'm sick. Mom says, I'm going to take away the phone until you go to school. 3 days later, they have the phone. Did you go to school? Nope. To me, that's compensating. I'm allowing and enabling avoidance to continue. Accommodating means we keep the demand and the task in place. So again, if we go back to those clear expectations, it helps us to make a plan for that. The other thing is, as parents, we are the authority. When did we stop being the authority? So if I say, you need to put away those clothes before the video games are played, well, if you run out the door and go jump on the trampoline, right now I might let that go. So I haven't yet compensated. But if they're on the video games before the clothes get put away, I totally am. So then I have to reassess and think about this situation and say, what's the barrier to putting away the clothes? Do I know where they go? Is it too hard? Are the hangers too high? Do I have, the pieces that I need? And do I need to make an accommodation? And sometimes we might just reinforce terrible behavior. I'm busy, I'm cooking, I'm cleaning, I'm taking care of other bodies. And I didn't pay any attention to that. So again, when you think about expectations, how do I set them up so I can actually follow through with them? So kids do well if they can. Ross Greene, anybody that knows Ross Greene, he came up with the idea of collaborative problem solving. It maintains parental authority. And he says, and I believe him, that kids do well if they can. They want to please us. Whether it be the teacher, the parent, the person at the grocery store. But I have to give them the opportunity to do that. So if I'm always taking over, if I'm always doing it for them, if I am doing all the work in the house and they never have to do any, how will they show us they can do well? If I teach too fast above their level, I'm likely going to see those behaviors. And so then we go back to that thinking error of I'm not good enough and I'm bad. So Adults' mindset, judgmental versus curious, willful and defiant versus too many stressors and skill deficits. Thoughts, he's lazy and just wants attention, is rude. What's getting in the way? How can I help? Our response, rewards and punishments, or find and remove the barriers. So this is really where that accommodation comes into play on the can't side. If I'm on the won't side, I'm probably going to compensate or just try to ignore it as long as I can. So frustration, guilt, and shame on the won't side, and supported and strengthened on the can side. So you can see, as we're going to shift into some resilience building things, we really want to be on the can't side of this. I want to give kids the opportunity to work through those stresses. I want to teach them the means to cope with the feeling that they're experiencing. I want to model for them the thoughts that help them to function the best that they can. Okay, so resilience is the ability to bounce back from stress, adversity, failure, challenges, or trauma. So we're going to help children navigate stressful situations, increase skills to confront and problem solve independently, take healthy risks, be curious, brave, trusting of personal instincts, no limits, and the willingness to step outside the comfort zone. So we can't protect kids from the obstacles. We just cannot. We cannot take all of those away. I would be exhausted trying to take away every obstacle that exists for the children that I work with, the children in my house, the children that I interact with on a day-to-day basis. There's bullies, there's tests, there's losing friends, there's divorce. So there's 4 types of resilience: physical, emotional, mental, and social. So Jane McGonigal is a game designer. And she loves to look at things like a game, which is probably why I like some of the work that she does. So we're going to play a little game today that's going to help all of you guys to practice resilience, okay? So we're going to start with physical. All right? So you're going to get choices in this. So you can stand up and take 3 steps forward, or you can make your hands and fists and raise them above your head for 3 seconds. Everybody play along. Come on, we're going to increase your resilience. All right, some overachievers are moving and putting their hands up. All right, we're going to do some mental resilience. Have a seat. All right, we're going to snap your fingers exactly 50 times, or you're going to count backward from 100 by sevens. 193, 86. Don't let the people distract you that are counting. 50 times. So the brain's a really big muscle, right? We want to increase our willpower. That's what you guys are doing right now. I hope you're all good counters. All right, emotional. So I'm going to do the work for you on this one, okay? Because we're inside with no window and we're not able to go outside to look in. So you can think about that one when you get home, or you can do an internet search for a baby and a favorite animal. And I looked up some baby pictures. Are you ready? Doesn't that feel good? Curiosity and love. So the 3-to-1 emotion ratio, please remember this, 3-to-1. In each hour, your child needs 3 positives to 1 negative emotion. 3-to-1. Don't forget that. Social, okay, we're going to practice some fears, right? So if you have a germ phobia, or you don't like people in your bubble, here we go. We're going to shake somebody's hand for 6 seconds, or send someone a quick thank you by text, email, or messenger. So, okay, stay with me so we can keep going down here. All right, strengths from others raises the level of oxytocin and the capacity for trust. We need people. Kids need people. Who becomes the model? All of us. Okay, so I think I covered all these, but I want to just list them through and make sure I didn't miss anything. So we're going to build resilience versus increasing anxiety. So we're going to resist the urge to fix or protect them. We're going to ask questions. I love how versus why. Why feels a little shaming to me. Why did you do that? Versus how did that go? Promote healthy risk-taking. Build a strong emotional connection. Demonstrate and model the coping skills. Label emotions. Teach problem-solving skills. Embrace mistakes. Go outside. Increase exposure to people who care about them. Build their executive functioning. So that's that prefrontal cortex, decision-making, problem-solving, planning. Encourage mindfulness. If you don't know what mindfulness is, just Google it. Tons of examples for kids and yourself. Really being connected to the present, here and now. Building feelings of competence and a sense of mastery. Nurturing optimism. Teaching them how to reframe thoughts. Facing fears. Do not rescue. Meet them where they are. Nurture a growth mindset. We can change and so can others. Show them you trust in their ability to cope. Let them talk, even if it takes them a long time. Try how versus why. Make time for creativity and play. Keep things in perspective. Nurture positive self-view. Look for opportunities for self-discovery. Move towards goals. Define them, label them, clear expectations. Accept change. Take a break. Maintain daily routine. Sleep. Your children need sleep. Please put them to bed. Staying up till all hours of the night is not helping anxiety. Have your child practice helping others. Find a purpose. Build a moral compass. Allow them to express themselves. And let them know they are loved unconditionally. And then I just have resources. And that's all I got for you.
Well, thank you so much to Dr. Sharma and to Anita for their excellent presentations. Hopefully you all enjoyed it as much as I did. In our remaining about 12, 13 minutes, we will field a few questions. We got so many fantastic questions after the first sweep. In the interest of time, we'll forego collecting additional questions and we'll work with a few of the top ones, the top themes that seem to come forward. So we'll start with the first question, and I'll lead it off to Dr. Sharma. How can you decide whether you should send your child to school with a stomach ache or a headache? How do you know if it's anxiety?
Yeah, I think that's a very important question. Like a lot of parents ask me, like you're saying that physical symptom is one of the symptoms of anxiety disorder, then how will we differentiate it from a real pain or headache or stomach ache? So I tell them that every stomach ache or every headache should be taken seriously. And then you have to relate it with the pattern. If a patient has a pattern in the past that every time when there's a headache, the first thing that comes to mouth from him is that he wants to go home. Or if the teacher thinks that, you know what, this was exactly not a headache or not a stomach ache, he just wanted to talk to you, and once he talked to you, the stomach pain was gone. So basically, you just have to start seeing pattern in any kid. If these continue to happen more than 4 or 5 times or 6 times in a year, then definitely that needs to be evaluated by a PCP or maybe a psychiatrist or a therapist. But definitely, there should always be a concern that there shouldn't be any medical going on with headaches or stomach aches.
That's good. All right. Very good. Thanks, Dr. Sharma. The second question. My child gets so focused or fixated on an activity or a plan for how the day should go. He gets very angry and violent if it doesn't go as planned. Is this part of anxiety? How do we ignore these behaviors, or should we?
Without knowing a lot of information, it's hard to know if it's anxiety. On some level, it sounds like there's some anxiety feeding that, but also if I have competing reinforcers of wanting to spend time playing video games, I might not want to do something. So again, be thinking about how we interact with the kiddo. Am I modeling? Am I problem solving? Am I helping them to understand how to manage the behaviors? Am I using systematic desensitization? Am I using an exposure process? So we really want to be thoughtful about what we're doing, how we're interacting, so that we don't continue to reinforce the anxiety if that's what it is, or even that behavior. This is one of those times where it's an inappropriate behavior. You don't get to be violent because you don't like something.
In closing, thank you so much to Dr. Sharma and to Anita for their fantastic presentations tonight. It was absolutely wonderful. And last but not least is a thank you to you for showing up tonight and for caring, and taking away some content from tonight that you can apply in your lives, whether you're a parent, a teacher, a community member that cares. That's really the whole purpose of tonight, is bringing people together, sharing information, learning from each other, and building a community of caring.